WA has reported 3,594 COVID cases, an increase of more than 25% on the previous day, as the state approaches the peak of its Omicron wave. There were 67 West Australians in hospital with COVID on Wednesday, up from 48 people on Tuesday and 36 on Monday. Crucially, none of the patients were being treated in intensive care, despite WA's active caseload reaching 15,570. There were also no S linked to the virus in the 24 hours to 8 p.m. on Tuesday night. Your cookie settings are preventing this third-party content from displaying. If you'd like to view this content, please adjust your cookie settings. To find out more about how we use cookies, please see our cookie guide. There were 17,528 PCR tests, of which 1,758 returned positive results. The remaining 1,836 cases were self-reported positive rapid antigen tests. Every region in WA recorded new infections overnight, with the vast majority again located in metropolitan Perth. That was followed by the Southwest, Wheatbelt, Pilbara, Goldfields, Midwest, Great Southern and Kimberley. The remaining 163 cases have yet to be assigned a region. The toll during the current Omicron wave remains at 3 after a woman in her 40s with underlying health conditions with the virus over the weekend. WA reported 2,847 cases on Tuesday, following on from 2,365, 2,270, 2,289, 2,137, 2,423, and 1,770. The rise is in line with WA Health modelling of the Omicron variant, which forecast 5,450 cases by March 13th and 9,700 cases at the end of this month. Meanwhile, the number of people hospitalized with COVID so far this year is tracking at about half the rate suggested by the modelling. The West revealed a total of 152 people have been hospitalized with COVID since the start of 2022 from more than 25,000 reported infections, or about 0.6% of all known cases. Modelling compiled by WA Health, which underpins the restrictions currently in place across the state, forecast 463,932 people would be infected with Omicron in the space of 180 days. During that period, it was anticipated 5,685 people would require a hospital bed, or about 1.2% of all infections. That is exactly double what has been observed to date, although the modelling also suggests a lag of around 6 days between symptom onset and hospital admission. A WA Health spokesman said the number of hospitalizations during the Omicron wave was broadly consistent with outcomes simulated by the model, but insisted it was not developed or released as a forecasting tool and should not be used as such.